Hi, I'm Katie Woolaston, biodiversity lawyer and educator from Queensland, Australia. I'm also chair of the Nature for Health Independent Technical Advisory Group, and I'm going to spend just a couple of minutes talking to you about the role of the environment and ecosystems in preventing pandemics. So much work has been done on human and animal health to curb the emergence of zoonotic diseases and spillover in the past. Unfortunately, though, not as much has been done on preserving nature to achieve health outcomes. That said, we know that the environment plays a key role in sustaining our health. People, animals, and plants depend on a healthy environment. Nature and natural capital is the source of health. We also know that zoonotic spillovers, particularly those of pandemic potential, are inextricably linked to the triple planetary crisis of climate change, biodiversity loss, and pollution. We currently focus on pandemics and disease, but if we truly embrace a One Health approach, we must include prevention of several other things, including the drivers of environmental deterioration that pollute our land, seas, and food sources. We need to preserve the biodiversity that underpins all life on Earth, and we need to shift our emphasis to prevention over preparedness and reaction and response, and be clear about what it is that we are preventing. Nature for Health advocates for preventative measures in line with the One Health high-level expert panel definition of primary prevention of zoonotic spillover. That OLEP definition states that prevention of pathogen spillover from animals to humans means shifting the infectious disease control paradigm from reactive to proactive. So prevention includes addressing the drivers of disease emergence, namely ecological, meteorological, and anthropogenic factors and activities that increase spillover risk in order to reduce the risk of human infection. This suggests that we need to work upstream so we can really reduce risk at the source rather than chasing the diseases as they emerge into animals and humans. We need to shift away from purely anthropogenic-centered focus on short-term human health outcomes and take a more preventative approach that improves the health of ecosystems, ultimately for the long-term benefit of human health. We need to tackle the root causes and strengthen human, animal, and ecosystem resilience and adaptation to shifting health risks. But how do we do this? Surveillance is important, response is important, and AMR is important, but relying on these after an outbreak means we are missing the whole upstream piece. Upstream prevention, though, means that we address the drivers of disease emergence at the ecosystem level, as the OLEP definition suggests. Any proposed measures, then, should start with an analysis of sufficient environmental laws and policies, as well as the research that relates to the specific environmental drivers of pandemics in your country. We need a change in mindset around how to prevent pandemics, and we need to collectively invest more in upstream prevention, which is rooted in the health of the environment, and link this to climate action, biodiversity conservation, and pollution and waste control. Now, there are several opportunities and entry points to help you with actions to achieve this, including the recently adopted CBD Global Action Plan on Biodiversity and Health. That action plan outlines many different types of upstream prevention policies, mechanisms, and actions, and we suggest that you consider whether some of them may be appropriate for your country's circumstances and your N4H application. Without preventative strategies that address the drivers and threats of spillover and disease from biodiversity to humans, and without tackling those at the ecosystem source, pandemics will become even more frequent and are likely to have increasingly disastrous impacts. N4H is about including the environment in your strategies, and that is where we all need to start.